Hello everyone, you are all welcome to lecture number 1269, and today's topic is leaky gut syndrome and its prevention and treatment. And if I am saying causes, the main cause is inflammation, either acute inflammation or chronic inflammation. Anybody who is suffering from inflammation for a long duration of time, what happens that our large intestine lining becomes thin, not thickness is reduced, and it will lose its permeability. And what will happen from outside, some undesired toxin, rotten material will start entering in the gut or large intestine, and in this way they will destroy and damage your good gut bacteria, and your gut will become very poor in its function. Your immune system will be affected, and your all the health will be in problem. You will be having always weakness, feeling fatigue, joint pain, or lot of abdominal pain. If all these things are related to your leaky gut syndrome. It is just like that, for example, border. If I am talking, there is border of Nigeria and Chad. If this is a strong border, it will not allow any Chadian terrorist to enter and pass into Nigeria. So whatever you have good forces here in Nigeria is strong, they are okay, they will take care. But in case if it becomes very thin, means your border is leaky and enough security personnel or protection is not there, then definitely a lot of criminals will enter and they will start destroying and killing the whole normal system of the country. The same thing is happening here in the case of leaky gut. Once you have leaky gut, it's a serious issue. First thing, the symptom what you will get gastrointestinal problem, always butterfly movement, gas, bloating, constipation, diarrhea, and always your stomach disorder will be there, and continuously you will be having a lot of health issue. It shows that you have the syndrome of leaky gut, and you should meet your consultant who is expert in gastrointestinal problem. And here there are some treatment. That treatment is, first thing, you have to change your lifestyle. Changing lifestyle means your eating habit, your laziness, sedentary life, and you cut down such type of foods which are refined, which are containing gluten and also sugar. So these are all very bad for our healthy bacteria in our gut. So these things should be drastically reduced. And if you have this problem continuing, then you consult doctor, and first test is that first you have to check the chronic inflammation condition of your body. And for that I have already told you the test. First is that is C-reactive protein test. That will give enough information whether you are having inflammation or not. Then count of WBC, that is blood test, stool test to understand the what is the colony of microbes in your gut. So these preventive measures are taken and treatment is given, but it is mainly related to your lifestyle. Lifestyle is playing very important role. It includes everything. Your all good or bad habit. Sound sleep is very important. Stress management is very important. If you can manage this, then keep away from toxic pollutants and even toxic people. I call them negative time. It will also add to your mental tension and stress, and that will aggravate the situation of leaky gut syndrome. So here in first picture you can see very clear normal gut where there is no breaking of the lining or becoming very thin, and it shows that this person who is having this type of gut means he is not suffering from chronic inflammation and his gut lining are intact, healthy gut lining, and he is not suffering from leaky gut syndrome. This is the image of leaky gut syndrome. You can see here that because of chronic inflammation, those gut lining, they have given the space, they became thin and they are broken, and very easily lot of toxin, then some negative bacteria, microbes, some waste material or some waste particles, they can enter the guts and they can disturb the healthy life of your gut microbes, and this condition is called leaky gut syndrome, and it happens, I have already told you, because of so many lifestyle factors, but the most important is once you are suffering for a long time from chronic inflammation. So here in this leaky gut, very clear picture of both. One is leaky gut, right side and left side you can see normal gut, and on top it is written the image of leaky gut. Very clear picture. So here I have given in the form of summary. Number one, leaky gut syndrome occurs when the lining of the small intestine becomes damaged and there is chance of permeability, the passing away of the toxin or some other rotten indigested food material, and that can disturb the positive healthy gut bacteria, and passing away all the toxins and undigested food particles and other harmful substances to pass through the gut wall and enter into the bloodstream. That is the meaning of leaky gut syndrome. Number two, causes and symptoms. So here causes are once you are on high sugar diet, gluten processed or refined food, junk food, you are having stress, maybe emotional stress, some other oxidative stress, over medication of antibiotics, and chronic inflammation, genetic disorder, and environmental toxins. And that is the main, these are all the causes, main causes of your leaky gut. And all these are directly linked to only one factor, the mother of all health issue here is chronic inflammation. Then symptom A. In A group of symptom is that is gastrointestinal symptom, means your gut will be having butterfly movement, sometimes it will be having bloating, release of extra gas, then nausea, vomiting, diarrhea sensation, constipation. All these factors are responsible because of your leaky gut syndrome. The non-gastrointestinal syndromes are, the symptoms, weakness and fatigue, always joint pain without any reason, and then skin diseases like acne and eczema, And cloudy brain means your memory is weak and difficult feeling, difficulty in concentration, that is pure memory, autoimmune disease, that is suffering from rheumatoid arthritis, then note here, and headache, migraine, and insomnia. So general condition I have given here, generally suffering from chronic inflammation, oxidative stress, nutritional deficiency, and hormone imbalance. They are actually one of the factors also for leaky gut. That all includes your disciplined lifestyle. Then diagnostic tests. There are some diagnostic tests, and that is, first there is test for measuring the permeability of the intestine, that is called permeability test. Number 2 is endoscopy. They will take the photography inside or image of your cell by cell, your small intestine. Then biopsy is done. Then stool test is done to understand the microbe condition. And lastly, to know the chronic inflammation by testing parameters of blood, C-reactive protein, and WBC count. Then what are the treatment? First treatment, change your lifestyle, means your eating habit, dietary habit, add omega-3 fatty acid, add ginger, add turmeric, because they are very strong anti-inflammatory foods, fermented food, add fermented food, and then keep your life stress-free and keep away from polluted area where a lot of toxins are there. So with this I will stop. Thank you very much for watching the lecture, and please, it's very important, take care of your gut health to avoid a lot of health issue. And if you have leaky gut because of your careless lifestyle, definitely you are going to suffer in the long run. Thank you very much.